Hello everyone. A very warm welcome to all of you into this live session. Manoshala aims to democratize preventive mental health care solutions in India, which not only focuses on clinical therapy but also focuses on alternative therapy. Manu, I, Tamanna Rajpal, who will be the host of today's live session, is an expert with Manoshala and I work as a child psychologist. I deal with kids for the behavioral issues. As you know, animal is that living being in the universe from which people not are only scared but they also love them. Each one of us see them in a very different perspective. But as we are growing, our country is also growing. Either it is health, either it is development, or either it is anything. But as so, it is also growing slowly and gradually. They are not only bringing changes in our treatment for our physical health but also coming up with different therapies for our mental health. As you know, Manoshala also focuses on alternative therapy. Our today's topic is based on the alternative therapy, that is animal assisted therapy. So I would like to invite Dr. Rex here. Hi Rex.
Hi, how are you?
I am fine. How are you?
Doing good, doing good.
Okay. So, right, we are very excited for this new therapy which we'll be doing it today, that is animal assisted therapy. So, I would want that if you can introduce yourself to us.
Yeah. All right, so my name is Joseph. I have a PhD in psychology and I've worked for over 4 years as a faculty in psychology. I'm currently also working as an assistant professor at CMR University, Bangalore. I have this venture of mine called the Dog Side. Now, at the Dog Side, we offer animal assisted interventions, and animal assisted therapy is one of those interventions. Right? So, animal assisted therapy is nothing but providing different kind of therapy services with the help of a co-therapist who's going to be a therapy dog or therapy cat. Whatever. So, in my case, I use therapy dogs. I work with my boys Thor and Loki, who are certified therapy dogs. And yeah, we've registered in Jan, and we've been running since last year. Basically, we've done a lot of workshops, and we've done a few sessions with special needs children. Also had individual sessions, but of course, not a lot because of the lockdown and the current situation. But yeah. We have a few tie-ups with a few different special schools who do sessions with us, and yeah, that's the gist of it.
Okay, that's great. That's great. I never knew that how animal assisted therapy can help special kids as well.
It is actually most commonly used among special needs children because they respond best to animals. I mean, in general, children respond best to animal assisted therapy as when compared to, older people. Of course, the elderly crowd also, the geriatric crowd also responds pretty well to animal assisted therapy, but we are trying to get into touch with a lot of special needs kids or organizations supporting them because I found it in the few sessions that I've had. I've found that it's very effective with special needs children.
Okay, that's great. That's great. Okay. So, like I would want that if we can wait for 2 minutes as so that people can join because
Sure,
we
sure.
have. Okay, yeah, we are joining. Okay, let's wait for another 1 minute, then we'll start.
Sure, sure, no problem.
Okay, so let's start. People will be joining. Okay.
Sure.
So, according to you, what is exactly animal assisted therapy?
And I see animal assisted therapy is it's not a therapy by itself. Right? That's one thing that we all need to understand. It's a supplementary therapy, right? It's like taking supplements. Now, how it works is simple. When you start interacting with a dog, I would be using the example of dogs a lot because I work with them, but then
Yeah.
different animals also elicit similar responses. So when you start interacting with a dog, what happens is first thing that happens in your brain is oxytocin release goes up. All right. So oxytocin is generally known as the love hormone. That's how common people would know it. Then the next thing that happens is the release of endorphins in your brain go up, right? Endorphin is what you get when you get a hug from someone, right? Then your heartbeat comes to normal, right? It becomes regular, right? And the last important thing that happens is your cortisol levels come down, and cortisol is the stress hormone, right? So what happens in animal assisted therapy is you use these effects, right? This oxytocin, endorphin, uh, heart rate, and cortisol level changes to help you in the therapy that you are trying to provide. Right. So in my case, for example, when I'm working with special needs children, usually when I'm working with special needs children, I also have an expert because I am not an RCI recognized, uh, person who can work with special needs children. So I have somebody from that area also working. But in case the special needs children are there only for counseling purposes, then of course, yeah, I don't work on the disability part. Right? What happens is when we work with children, with the combination of these four things happening, rapport building becomes very easy, right? Often you will see that in terms of special needs kids, they have difficulty in communicating with people, in terms of socializing with people, etc. So that becomes very easy when there's a dog around. They want to play around with the dog, etc., etc. Right? That's the children part. Now with adults also, I use animal assisted therapy in my counseling and psychotherapy as well. So there, what happens is a lot of times when a client comes in for counseling, the first time a client usually comes in for counseling, they're not really sure what they want or what they're supposed to say. There's a lot of hesitation. They are also anxious and all that, right? So what happens is the presence of the therapy dogs help them loosen up, right? It helps them become more relaxed, etc. So what we do is we use these effects that the dogs have on people to help with our therapy process, like we be it with special needs kids or with adults, right? So we start so, for example, a client who's coming in for a first session, naturally they'll be a bit stressed. They'll be a bit anxious. Their heart rate will be high. Right? So, what happens when they start interacting with the dog? Immediately, their heart rate comes down. It's not that they have to consciously try for their heart rate to come down, but rather it comes down. Right? The cortisol level comes down, their oxytocin goes up and their endorphins go up. So they're already feeling in a happy place. They're already feeling happy and fine. So then it becomes easy with the rapport building part. Now, fast forward to your actual counseling session. Let's say, they're narrating an incident which is really difficult. All right. That could lead to a breakdown. It happens. I mean, anybody who's conducted a counseling session would know that in between breakdowns can happen. There also, the presence of these animals will help bring down their heart rate. The heart rate which goes up comes right back down. And then the cortisol level which goes up also comes down, right? So what we're doing is basically it's like administering some kind of a drug while you're giving therapy. The only thing is you're not giving a drug, you're eliciting those responses when they interact with the dog. right? So it's supplementing. It's but if you're using only the animals for therapy, that's not called animal assisted therapy. That's called pet therapy. So most of the organizations in India offering these kind of services, they have pet therapy because they don't have a lot of therapists on board. At the dog side, we only have certified therapists on board. We have a social worker on board. We have a physiotherapist on board. Of course, right now they're all in different places because of the lockdown and travel restrictions and everything. But yeah, and we've got a couple of psychologists. I'm a psychologist. We've got students who completed their masters. The other director is also a PhD in psychology. Right? So we are an organization which is run purely by psychologists and other therapists. And animal assisted therapy is not restricted only to people who practice psychology. It can be used in physiotherapy. It can be used in different kinds of therapy. The only thing is you need to be a licensed or a certified mental or physical health worker, right? You need to be certified or a licensed person, that's all. And you can incorporate this into your regular therapy sessions.
Okay, that's good. Thank you. So, does animal assisted therapy is work for everyone, or does it better work with a specific behavior?
Now, see, in general, there are studies which have shown that animal assisted therapy works with almost every mental health problem that's there. All right. There are specific studies on how animal assisted therapy works on schizophrenia, Alzheimer's, dementia, ADHD, autism, etc. So see, what happens is if you look at the number of studies being done, there are a lot because every day people are finding a new use for animal assisted therapy. It's even helped, in especially kids who undergo chemotherapy, etc. It's used to help in their treatment also, right? So, like I said, what happens when you interact with an animal is these chemical changes happen in your brain, and you can imagine with any kind of a situation when your oxytocin and your endorphin goes up, you're already feeling relaxed, right? Any kind of a therapy, any kind of a mental health or any kind of a physical problem, these things go up, you're already feeling relaxed. When your heart rate comes down, you're feeling better and your cortisol also comes down. So it can work in almost any situation. Now the only thing is, of course, a person who's coming for animalistic therapy has to be comfortable with dogs, right? That's the only thing. I mean, if they're scared of dogs, then it can lead to the opposite reaction. So in that case, if they still want to try and do it, then we start with desensitizing them to the animals, and then we go ahead. Okay, there are a couple of questions that are coming up. Do we answer them at the end, or how do we do it?
Whatever, like I would like we always do it at the end. So I do
Fine.
remember
Fine.
these questions
So
you
if you
wanted
can
to
just
ask.
make a note of the questions, that'd be
Yeah,
great.
yeah, I'm making it. Yeah,
All right.
yeah. Okay. So can animal assisted therapy take place online, and with what kind of pets we can do this activity?
See, when you're considering doing it online, I would say that we would never reach 100% efficacy, right? Because
Yeah.
how animal assisted therapy works is basically when you touch them, right? When you run your hand through their fur, etc. That's when all these changes happen. It's like going and getting a hug, right? Can you get a hug virtually? You can't, right? So it's similar, but at the same time, there is I wouldn't say it doesn't work at all because if you look at how people react when they see the picture of a puppy or a kitten playing, you feel good. Even if you're not feeling really great at some point, all of a sudden you see a puppy picture on your Instagram feed or your Facebook feed, then you feel good, right? So, yes, it does work, all right, but efficacy would differ. Right, it wouldn't work at 100% efficacy, and it would work only with people who really like animals. Right, if you have to start with the desensitizing and everything, it wouldn't be that effective.
Okay. Okay. So, and what kind of pets do we use for this? Do we specifically use dogs, or can use any animal?
See, it's all about what a person is comfortable with, right? So I use dogs because I've been around them for quite some time. I'm a certified trainer as well. So I like working with them and I find it easiest to train them, right? When you're looking at most of the animals, dogs and then horses are the most easy to train. The others not so much. For example, you try training a cat, it's gonna take a lot more time and a lot more effort, right? But it depends on the person as well. There are people, so if any of you want to check it out, you can go on YouTube and search for crocodiles as therapy animals. There are people who use crocodiles as therapy animals. There are people who use pythons as therapy animals, right? So it's all about what works for the individual, right? The only thing is, when you're using an animal as a therapy animal, you need to be sure that the animal wouldn't react aggressively, it wouldn't try to bite you, harm you, etc., and it would remain really calm, right? And that calm factor is something that you always want, because you're trying to provide therapy over here. I mean, I wanted to show you how Hope is, but right now she's just passed out for the day. Right? There she is, curled up. Okay, so she is not a therapy dog. She's not a therapy dog. She's just my pet dog. And my therapy dogs, Thor and Loki, we're starting a center, full-fledged center for animal assisted therapy. So we place them there. So you need the
Okay.
animal to be calm. There are people who use birds for therapy. Right? There are people who use fish for therapy. Right? Fish is among the most easiest because watching them itself is therapeutic. Right? So I think if any of you want any more details, we go on to the dog side page. We put up multiple posts on how different animals are therapeutic. We put up different. There are people who use mice. People who use rats. We put different case studies which mention all these things. So, yeah, you can get live examples as well.
So it's a group activity or a individual activity? Like we do the therapy in a group or in an individual or both?
That's completely up to the client's requirements. So when we go to the special needs schools, usually what we do is we start with a group activity, so that all the kids warm up. We have them play games around the dogs. Run around with the dogs, take them for a walk, brush them, whatever they want to do. These therapy dogs are so toned down that kids can literally do anything with them. Play with their ears, but there are kids who put their hand inside their mouth, they wouldn't bite, right? So it all depends on the requirement. The only thing that you need to keep in mind is, see, a therapy dog who's above a year, more than a year old, that's when they're ideally supposed to be used as therapy animals, can work for maybe 1.5 to 2 hours max at a stretch. Right? If it's a puppy that you're using, a puppy who's in training, probably a max of 45 minutes to 1 hour. Right? After that, you need to give them a break. Right? Whatever be the situation, you need to give them a break, because without the break, it becomes very difficult for them. Because see, what happens is, at the end of the day, you're conditioning them to do something, right?
Yeah.
Once it crosses a particular threshold, they stop uh, they start losing their attention span, right? Then they wouldn't be as calm as they would be, because they would also want to stretch their legs, run around, play around, go pee, and all that. So you just need to keep in mind that timing has to be maintained. And even if you're working with therapy dogs full time, I would never recommend working more than 4 hours in a day, right? So you can either do 2 2 hour stretches, or maybe 1 hour, 4 1 hour stretches, not more than that.
Okay. How does animal assisted therapy work and what we do it in exactly? Like what all we do in it exactly?
You mean the activities that we do?
Yeah, yeah. A little bit of if you can brief about the activities to us.
See, that completely is dependent on the client. So if the client is really comfortable around dogs, in my case, I ask the client to take the dog for a walk. Right? Like right when I will be there, of course, most of the times if the client is okay with it, I prefer to do it in an outdoor setting. But if the client wants to do it indoors, that's also fine. These guys work anywhere. So if it is an outdoor setting, I give them the leash and I tell them to take them for a walk. I'd be around, but they can take the dog and go for a walk,
Yeah,
play with the dog, whatever. Sometimes, some people want to give treats to the dog. So then I give
yeah,
them treats and then they sit and give treats to the dog. There are some people who are really comfortable and they want to brush the dog. For example, Thor is a golden retriever. Right? You brush them 3 times a day, they'd still be fun. So I always have the brush with me. If they want to interact with him in such a way that they want to sit and brush him, they can do that. So it's mostly designed according to the comfort level of the client. Now, some clients are not very comfortable. So what we do is I take the dog on a leash and I walk with them. All right, the dog is with me, but we're walking together, and over a period of time, I give the leash to them. Right? When it comes to kids, sometimes what we do is we design different games. A lot of these games that kids play, we make them do it around the dogs. Like when you're doing a group activity, like there's a musical chair and all that, right? So when we play the musical chair, the dogs will be right somewhere around, either in the center of the circle, or walking around or running around with the kids or something like that. So it is usually designed to what kind of situation you're in and what kind of activities, because it also depends on the physical comfort of the client. right? If the client is not comfortable walking, because sometimes we have clients who are disabled. So in that case, it's fine tuned to them. If somebody who has a lot of energy and wants to run around, I give them Thor, I ask them to run, Thor runs with them, right? So it all depends on the specific requirements of the. This is very animal assisted therapy is very customized. It's very it's the programs, the therapy programs we design are really custom made to each individual. So the requirements would change. So I would ideally say that no two clients have had the exact same activities.
Okay, thank you. So, how do you basically define animal assisted therapy to your clients, basically? Like, how we can tell the client that, okay, you will be starting with animal assisted therapy, because we always explain our therapy as well. So, how do you explain that?
See, one thing is our the dog side as a venture is known for animal assisted intervention. So anybody who comes to us is looking for animal assisted. Of course, we do also offer counseling services because we've got psychologists on board, but we've never had anyone approach us for counseling services. Right? That they reach once they're comfortable, they know about us, and then they know that we're counselors. Then they ask us. But otherwise, anyone who comes to us is looking for animal assisted interventions. All right. So then what we do is if they want an explanation, we just tell them, how this is going to help. All right. Like, how is it going to be different from the other regular therapies or sessions that they have? That's about it.
Okay, okay. So, can you share a brief example of a time animal assisted therapy had a therapeutic effect on any of your clients? Like, they were very happy.
All right, so I can give you the best example that I've had since last year. So I started going to the special school in Bangalore. So we couldn't have a lot of sessions because of the lockdown and all those things. But then in between, when it opened up, we had a couple of sessions with them. So I still remember the first session that we went. So these kids had never met Thor and Loki. I had
Okay.
never met the kids. It was a first time interaction. Right? And what happened is the first 1 hour we had a group activity where the kids were playing around, running around the dogs and all that. We had fun. I had fun. We all had fun. Right? But some kids were a little bit scared. They didn't know, probably their first interaction with dogs, but they also suddenly warmed up. So by the end of the first hour, all the kids were playing with Thor and Loki. After that, they had a snack break. They have this tea and snack break, which is there in every special school. So they went in for the snack break, and 15 minutes later, they were all outside. So then the special educator walked up to me and they're like, this is the first time since we started this school that all these kids just finish their tea and snacks without us having to tell them to do it. So usually, apparently, they have trouble making them sit, making them eat their snacks, etc., etc. This time, they had absolutely no problem. They just all the kids just walked into the room where they have their snacks, sat on their tables, had their tea and snacks. 15 minutes, they were out. Right. So what that shows is nothing but how much these kids want to interact with the animals, right? And that's what we're trying to establish with animal assisted therapy, right? People wanting to interact with the therapy animals means they have to interact with us also. See, it's always a process of translation, right? So somebody forms a rapport with the therapy animal, they inevitably have to form a rapport with the handler. So in my case, it's me, right? And if I have another therapist also on board, like I said, when I work with special needs kids, I usually have a special educator, or I have a speech therapist or a vocational therapist, etc. So what happens is these kids, they form a rapport with Thor or Loki, then that rapport transfers to me, and they're talking to me and interacting with me. The therapist is right there, it transfers to the next person, right? So that is how it works. And the thing is, this and all these kids have always been asking. I've had parents from that school call me up and ask me, when are you coming next? Right? So it's all about, when they want to interact with the pets, we know that we can deliver the therapy also whenever they're interacting. So that's the best experience I've had so far.
Okay, that's great. So that was the last question. And
All
now
right.
I would ask the audience questions from you. So
Yeah, I
our
think you've
first,
already put up a few questions.
yeah, our first question is by Akansha. Do we have ETET certification in India? Like animal assisted therapy is certified in India?
And I see animal assisted therapy is not regulated by any body as of now. In India, there is no central government regulatory body for animal assisted therapy, but that's the case for most of forms of therapy, right? Even if you look at psychology as a practice, except for clinical psychology, there's no other branch of psychology which is regulated by any body. There's no regulation, right? But I'll tell you what's the basic requirement for animal assisted therapy. One is you need to be a certified therapist of some sort. And certified therapist, I mean a psychologist. If it's a psychologist, that means a postgraduate in psychology. It can be a social worker, it can be a doctor, it can be a nurse, it can be anybody who is certified to provide some kind of therapy service. Right? That's the first requirement. Second thing is you need to know a little bit about animal behavior, right? Because see, when you're working with a client and an animal, you need to make sure that the dog or the cat or whatever animal you're using is not going to do anything that might not work out well, shouldn't bark, shouldn't bite, etc. So you need to know about animal behavior. And it's always good to have some training in how to train your animals. So that's why I became a certified dog trainer as well. Now I train dogs with other people as well. And then you need to know how to incorporate. So every person who uses animal assisted therapy would have a little bit of difference in how they use it, right? So it's like I said, you take the fundamental principles of how what happens when you interact with an animal, and then you try to bring that into your therapy. You try to figure out how those effects are going to help in your therapy. Now there are no again certification registered, no, there's no government regulated body, but there are organizations which do workshops on animal assisted therapy. And where one is the dog side, we've done 2 or 3 batches so far. There are other organizations also. They're all private organizations which work in the area of animal assisted therapy, which provide certificate programs. Some are 3 day long, some are 1 week long, etc., etc. So if you want to really pursue animal assisted therapy, the best thing to do is take up one of these workshops. That'll not make you an animal assisted therapist, because getting into animal assisted therapy requires a lot of effort, a lot of time, because you've got to get your animals trained by someone, you've got to go train yourself as a handler for the animals, etc. But it'll taking up one of these workshops will help you get an idea on what's involved, what's not involved, because it's just not what you see in TV, right? There's a lot of other ethics involved, there's a lot of other things, do's and don'ts involved. There's a lot of time commitment involved, etc. You can't really have a life outside their world, right? So the workshops will help you figure out whether this is the right thing for you. And then if you want to go ahead, of course, any person who conducts a workshop will be able to guide you through what can be done if you want to practice animalistic therapy.
Okay. Then we have, how does it work with ADHD?
See, ADHD, I'll do one thing. I'll just go generally into the special needs children, right? Not just ADHD. See, what happens with a lot of children who suffer from, different kind of disorders is the special needs children, is that they have trouble in terms of communicating, right? And generally their trouble in communicating is because of the fear of being judged, because of the fear that they've always been seen as a different person, and they don't know whether, so that is always there. That fear is always there. So that lack of communication leads to a lack of socialization, right? Because they don't want to communicate, they don't. So when I work with special needs children, the primary areas that I look at is the communication and the socialization, right? So let's say, for example, a child who's hesitant to talk to other people, right? I mean, of course, they're afraid of being judged, they've had bad experiences before, etc. So what happens is, when they come for the session, we encourage them to talk to the animals, right? So we'll be like, you can ask them their name. I mean, of course, we know that the dogs are not going to respond, but these kids love doing that, right? They start opening up, they start talking, and then slowly what happens is they'll talk to the person next to the dog or next to the animal, right? So they'll start communicating. They usually will be like, uncle, what's this? Uncle, can I take him? Uncle, that. So the communication channel gets established there, right? So that eventually leads to socialization. So once they start a communication process with me, then they're okay in communicating to the therapist also, because the therapist is my friend. See, how it works is simple. I'm the dog's friend, right? So I'm their friend. So A is B's friend, B is C's friend, so A becomes friends with C, right? So I'm the dog's friend, they're friends with the dog, they become friends with me. And then when they become friends with me and then we start having interactive sessions, the therapist, if I'm the therapist, easier, much easier. But if, I have a special needs RCI recognized person with me, then they become the next friend. right? So it helps in establishing better communication skills and socializing skills. And even when I do group activities with children, these children who wouldn't talk to each other because they're all staying in different, they stay a bit far from each other. When we have an activity which involves the dogs, they end up talking to each other. They'll be like, hey, I want to touch him, hey, I want to touch him, hey, I want to do that, okay, let's take him for a walk together, let's take them for a walk together. All those things come up, right? So what happens is their socialization goes up, right? Their socialization levels go up, their communication levels also go up. And of course, it doesn't happen. You will not find you'll not find a changed person within one session or two sessions. It's a gradual process. But what happens is these children become much more receptive to the therapy that's being provided to them, be it speech therapy, be it vocational therapy, be it any of those therapies. They become much more receptive because they know that the dog is also there. The dog is their friend. The dog is watching. The dog is around them. So they're like, okay, let's do this. Okay, let's do that. And usually, when we design a module for these kids, also, we try to make it as interactive and as much we try to include the animals as much as possible in the activities we do. So it's like they're trying to do it with their friends. They're trying to do it with with a new friend. So that makes the process much faster, the therapy process, and they respond better to it.
Okay. Okay, so we had this question that is it good for special needs children? Like, I think you have answered that.
It is, it is. It definitely works best.
So, can we use animal assisted therapy in case one has a fear of animals? Do you think that that will help?
See, and in that case, we'll have to start with the desensitizing program. All right, we have to desensitize because otherwise, it's gonna, those things that I said about heart rate going down and the cortisol going down and all that will not happen. The opposite will happen. See, when you're scared of an animal and you see an animal, it's the fight or flight reaction. Your heart rate will go up. So if a person really wants to try this out, then of course we can put them through a desensitization program where they're gradually exposed to the animals and they become comfortable with them and then use them. But if a person is really scared of them, we can't straight away start. But then see, again, like I said, it's not only dogs. We can even use fish for therapy, right? So I have fish at home. I mean, I personally have fish at home. You can always try and see whether you can use the fish in your therapy instead of the dog. Right? All depends. Like different people are comfortable with different animals. So if a person comes to me and they're not at all comfortable with dogs, but they're comfortable with cats, then I'd have to find somebody who has a therapy cat and can work with them. Right? So if the person is not comfortable, then if you force it on them, it doesn't really work well.
Okay, okay. So, okay, thank you, Rex. And I would want to know one question. Like, you know, that in special need, we have different other issues, like I would say speech or like a working issue. Or so, how does that can also help with us with the animal thing? Like, animals can help us with that also.
See
Because a
what
lot of
happens
time,
is Yeah. See,
yeah.
what happens is we have different therapists for all these things, right? For example, speech, we have a speech therapist. For vocational therapy, we have that. We have trainers of different sorts who work with special needs children, right? So you couple this trainer with a certified therapy animal and the handler. Whatever therapy it is that they want to provide, the child will respond better to it. All right, the efficacy will go up, right? Otherwise, directly they wouldn't help. But because of their presence, you mean compare a session without a therapy animal and a session with a therapy animal. The session with a therapy animal, the child would be more receptive, right? Would learn faster. So yes, it can be used in all different sorts of all different facets of working with special needs children.
Okay, okay, okay. So that's all, Rex. Thank you so much. I think we don't have any other audience question as well. That was the
All
last
right. So if
question
any
I
of the
had.
audience has a question, they can definitely drop a message on the dog side page and we respond. Any questions or clarifications, they can do that.
Okay, okay. So thank you, Rex, so much for this amazing
Yeah.
event. Like I was very looking forward to understand about animal assisted therapy. So thank you so much.
that- Yeah. Thank you.
Okay,
Thank you.
thank you. Bye.
Bye.
Take care.
Bye.